The condition depicted in the model is necrosis. Necrosis is the type of a cell death which is differentiated from the apoptosis, which is also considered as the type of a cell injury or cell death. The difference lies in the fact that necrosis is always pathological, whereas apoptosis, which is also called programmed cell death, can be physiological and pathological both. The characteristic feature of necrosis which differentiate it from the apoptosis is that necrosis is always characterized by inflammation regarding with no relation with its types. All kind of necrosis have some kind of inflammation which differentiate it from the apoptosis. The definition of necrosis, it is basically reversible cell death characterized by premature death of cell, and the main cause of such death is inflammation, infection and lack of blood supply. The main causes of necrosis can be listed below. Coming to the causes of necrosis, the first is pathogen, that any microorganism which is responsible for the necrosis. So the first type is microorganism or the pathogen. Second is the ischemia, that is lack of blood supply, also leads to necrosis. Third type is physical injury. Any kind of physical injury or trauma can also lead to necrosis. Fourth type is chemical injury. Chemically, any toxins or drug induced toxicity or any sort of thing which is creating some kind of changes in your body chemically, which is leading to necrosis. And the last type is inflammation. Like, it can also be the outcome of inflammatory triggers. So these are the main causes of necrosis which occurs in body. Now coming to the types of necrosis. The first type of necrosis is coagulative, second is liquefative, third is gaseous, fourth is fibroid necrosis, and the last is fat necrosis. The model depicted is of coagulative necrosis specifically. So now we'll try to understand what exactly is coagulative necrosis and how can we differentiate it from the other type of necrosis, what are the gross morphology, and what are the cardinal symptoms of that particular type of necrosis. In order to differentiate between different types of necrosis, you have to assess the type of a cell, the type of a necrosis on three parameters. The first is architecture, how the structure of a cell is, second is nuclear detail, and third is cytoplasmic details. These three areas and these 3 points will help us to assess which type of necrosis it is. Now coming to our type of necrosis which we are discussing is coagulative necrosis. The cell which have gone through the coagulative necrosis have certain features. The first, they have the intact archaeological appearances. That means unka jo structure hai, the structure of that particular cell is intact. There is no deformity in the cell structure. Okay. Second, they have lost nuclear and cytoplasmic details. So when we see this slide, which I'll be attached with this particular video, you will notice that such cells have intact the cell structure, but inside of that particular cell we can't see the nuclear details, we can't see the cell organelles, we can't see the cytoplasmic intact. So such cells are called tombstones. Matlab, like a tombstone, like a dead cell, just like a ghost cell. So we have two more terminologies for a cell which has gone through the coagulative necrosis. Such cells are also called ghost cells or tombstone cells. Okay. And as depicted in the model, that we have shown the coagulative necrosis in the most common condition which where we see this thing is ischemia, and the site is hard and the condition is called myocardial infarction. Most